Hello everyone. Sorry for this 5 minute delay. Here we are with our webinar 2.0. So, last webinar we talked about the mental health issues that young people are facing. This webinar would deal with youth leadership in the times of COVID 19. So, as you know, we are going to discuss today about the global youth response to this pandemic and how young people like you are taking action on ground, and also how you can build your leadership skills to cope up with this crisis. We have three panelists today here. One is Manizha Nuzhat. She is working as an UNV in UN mission in Afghanistan. Then we have Pawan Kumar, who is a district youth officer with NYKS, Ministry of Youth Affairs and Sports. Then we have Arina Tulaeva from Russia. She is eco grad from St. Petersburg University, and also she has been a World Youth Forum panelist in 2018. So I'll be moderating the webinar. So I'm Naveen Kori. I have been an ex-Clinton fellow. So there are very like small instructions like please turn off your microphone. If possible, turn on your video. Do not speak unless you're allowed to. Then use your chat box if you have any questions. We'll always try to answer them, and also if you have any technical issues. Also, this webinar will be recorded and published on our YouTube page, so you can also watch later and share it with others and enjoy the webinar. Small disclaimer again, this webinar is only for informational purposes. The views expressed here are completely personal of both the panelist and moderator. It does not link to our organizations. So first coming to this project. So this project was started in April 2020 when the whole crisis happened. So basically, we are trying to fight misinformation, also engage young people like you towards fighting this crisis, and also supporting stakeholders. So we have designed a website for the same, where you can get authentic information. I will just take you through for a minute there. So if you can see on your screen in a second. So this is the website that we have built. So there are various menu in this. So if you just click here, you can get the airport status, which airport is working, not working. Then the vaccine status, what about the COVID vaccine, how is the process going on. Then you can predict how many number of infections are gonna happen in the coming days, months, and year. Then also some data analysis related to the COVID-19. Then in this box, you can see. The total number of death and confirmed cases, which is updated every regularly. And if you want to get tested, if you click this link, it will take you to the information related to testing centers. And if you have mental health issues and if you want mental health support, you can click this link and it will take you there. And also, if you're interested in even SDGs, you can know more in this link. And WHO has its official WhatsApp, so just click this link to join the WhatsApp link of WHO, where you will get authentic information. So if you come down, you have country-wise information related to number of cases, deaths, etc., all from the official government sources. And here we are going to put some success stories of people fighting COVID-19. Here you can find blogs and some videos related to COVID-19. You can also subscribe to the latest information here by putting your email, and you can go to our social media sites and follow for regular updates. Coming to the main part, so you can join the volunteer task force that we have created, where young people like you from different parts of the globe have filled this form, and they're trying to help us in various ways, both online and offline. So you can be a part of this too. So coming back to our presentation. Just a second. Okay, here is our presentation. So, so our first thing would be like to discuss how the COVID-19 has impacted global youth, especially in education. So, out of the total population of students enrolled globally, UNESCO has estimated that 89% of students are currently out of school because of this COVID-19 lockdown and closures across the globe. Also, this represents 1.54 billion children and young people who are enrolled in schools and universities. So, in that, 743 million girls are out of school this time, out of total 1.54 billion children and youth. And over 111 million of these girls out of 743 million come from the least developed countries where education is already a struggle. So, if you uh, talk of like countries like Somalia and other African countries, the situation is very grim there. Then, how it is affecting the employment of young people? So, according to the International Labour Organization, there is already loss of 195 million jobs within 3 months of this crisis. And also, if you come to United States, the unemployment rate has increased to 14.7%, which is highest since the Great Depression of and also the 2008 crisis. So, three more than 3 million have people have filed for unemployment benefits in US since mid March. Coming to India, so 27 million youth in the age group of 20 to 30 have already lost their jobs because of this crisis just last month, because of this lockdown also. So India's unemployment has also increased to 27.11% just this last week in 3 May. So this has affected young people both in terms of education and employment. But according to UN Secretary General's remark, recently he told the world cannot afford a lost generation of youth, their lives set back by COVID 19, and their voices stifled by a lack of participation. What he really means is that young people should overcome this crisis through innovation and through finding new ways. So the first example that I would give you of a success story of a young man from United States is Avi Skiffman. So Avi Skiffman is just a 17-year-old high schooler who studies in Washington State, United States. So he launched a website called Yenco 2019.live in early January 2020. So this website basically gives the quick facts about COVID-19 and all the data from different countries. So his website has had more than 700 million visitors by now, and every day his website is visited by more than 30 million people. So such a young kid has done such a great work, and the whole world is acknowledging his work. And recently he was also offered $8 million for ads to be put on his site, which he has rejected. He told that I don't want this money to put ad on my site, but I want to keep it ad free. So he fundraised money from people through his website, and through those funds he's running his website. So he's not even caring about money. All he cares to help people fight misinformation and give authentic data in this difficult time. So this young person is a brave example, like how you can overcome the crisis and do such great things. Then we'll hear more of such stories from our panelists. So first I would like Manizha to go on with her presentation. Manizha.
Hello everyone. Thank you so much, Naveen, for the nice introduction. Unfortunately, Afghanistan is also passing through COVID-19 like other countries. Moreover, more Afghans are simply not taking the threat of virus seriously. And frequently they are going to packed markets, going for picnics, visiting their friends, and ignoring the quarantine guidance. And there are some reports that some Afghans, fearing the religious stigma attached to the virus, and they are hiding their symptoms and refusing to seek the medical help. So the government request and the government and the religious leaders have requested all the Afghan people to and encouraging them to if they have symptoms or not, to seek the medical help and medical assistance to ensure that they are not, I mean, in the COVID-19 pandemic situation. And as well as you can see in this slides, we have more than 5,000 people that that they are, I mean, passing the COVID 19 and the coronavirus cases in Afghanistan. And as well as we have 136 deaths till yesterday. Don't have the exact number of deaths for today, and as well as the recovered patients or 691, that it's showing that day by day it's going to we are going to have more patients having COVID-19. And as well as, meanwhile, the government has sent 2.36 million AFA to provinces hit by COVID-19, including 28 million to Herat without external support. They are not taking support from outside till now, and according to the Afghan Statistic Office, there are 536 hospitals with approximately 15,000 beds and roughly 3 doctors for every 10,000 patients. And it's really tough to manage the COVID-19 situation in Afghanistan. And we have like obviously we have 35 million people living in Afghanistan in total, but we have only 3 doctors for every 10,000 patients. So it will be not enough to fight with COVID-19. And as well as the Afghan Ministry of Public Health reports that there are only 30 or we can say 300 ventilators in the whole country, that they are managing the COVID-19 patients. And as you can see in the slides, we have our robotic team and the young ladies that they built a new ventilator for to help the COVID-19 patients and to help the medical team in Kabul or in Afghanistan to fight with COVID-19. But unfortunately, till now, it's not approved from the Ministry of Public Health and MIT Institute of US to use this life-saving ventilator. So they are waiting for approval of this ventilator, and then they will go on. And as well as you can see, we have another youth leaders and youth group that they are producing thousands of masks for people who are in need, and they are distributing among them. And as well as not only in Kabul, but other provinces like Herat, Mazar, and other provinces. So I think they are the good examples of the Afghanistan, and we are proud of them that they are fighting with COVID-19. And not only in Afghanistan, we have good examples of youths that they are fighting with COVID-19 in other countries as well. Like we have another team. Um, Naveen, can you please go to another slide? Yes, as you can see in Squad Association in Hong Kong, they are managing the spread of COVID-19. The incoming international travelers, they must self-quarantine for 14 days, and we are quarantine tracking bracelet. The bracelet is then connected to a tracking to a trackers for the travelers, and they are tracking the locations of these quarantine patients and making sure that they are remain inside, and they are in their locations, and they are not going outside and during this current quarantine time. So I think it's a good way to manage the spread of COVID-19 over the country. And as you can see in the next picture, we have another young lady that her name is Atfir Tumaison, that she is from Nigeria, and she just mobilized a few friends and set out to raise awareness among the people in their country and in the location that she was living. And she just raised some awareness among the sellers and buyers in Budija and Sango market in the city of Ibadan. And she wanted to ensure that at-risk people, especially the illiterate and those who doesn't have access to the internet and She wanted to give these examples of how to ensure that they are safe from COVID-19. And she she showed proper hand washing techniques and distribute gloves and masks among these young or old people who are living in this village. They also educated people about the precautionary measures for avoiding the COVID-19, and also she distributed the emergency contact number to these people because she wanted to ensure that if they have or if they faced any problem, they can contact them and they will come back with help to this village. So I think these are the examples of other countries as well, that not only Afghanistan but all over the world, everyone is suffering from COVID-19 and everyone is fighting with COVID-19, and we should take care of the rules of quarantine, and we should not break the rules, and we should stay home to stay safe and to save lives.
Yeah, thank you, Nuzhat. Now we'll move on to India. So I request Pawan Kumar to talk on the situation in India and how young people are overcoming this situation. Pawan.
Hello everyone, am I audible?
Yeah, you are audible.
So at first I'd like to thank Mr. Naveen. Thank you for giving such an opportunity to interact a lot of youngsters, and especially I thank Manu and Arista from Russia and frequently Afghanistan for joining us. And I like to also thank all of the viewers, those who are, you know, joining our webinar. So like especially like India is a very different country apart from all countries in the globe. So once like COVID-19 had we got cases from our country, so government become very active. So far if you will look at the status from our slide, like we have an active case of more than 51,000, and there's like 264 2060 649 cases have been happened. So but you know, if you look at the our topic of this seminar and all, like we are here talking about the young people, those who are doing really well in this pandemic. So like especially if you look at the India, so due to its culture structure, or you can say the secularism part, and in the geographical condition, it's very important for the young people to support government and their communities to help this pandemic. So we have a lot of actually so many stories if we count, but from the rural India, and if you look at the urban India, because we have a different set of problems in different set of segments. If you look at the northeastern side, so we have a different conditions here. We have a southern India where we have a lot of different conditions. So if we take across our Indian continent, total Indian countries, we have a so many young guys come up with so many innovative idea where they can helping government. They are volunteering for the governments, and even most of the youth have taken so many steps to come up with their ideas. Some few a large population is helping through the government, spreading knowledge, spreading correct informations to the people, and like few are very active in providing rations and to the very needy, to the very upstream conditions people. So I have picked one story from India. I hope you will like it. So it's a story of Parushia. He is a young Indian fellow alumni from Ashoka University. It's situated in Sonipat of India. So he has made remarkable contribution towards COVID-19 relief measures by working with the Delhi government to establish over more than 400 relief centers. So it was not easy to establish in a very short period of time to a number like it's, I think 400 relief camp center is a very big number. So if you look at the situations of Delhi, we have a lot of migrant workers from other parts of the country, and like very dense population. So Delhi government were, you know, taking a lot of steps to provide uh, essential medicines, relief materials, fooding to each and every individual though who were stuck in the COVID-19 lockdown in the Delhi. So he came up with an idea of mapping public data sources. So he used the data sources from the government and all other participants and all other civic society engagement for mapping relief camps. So his work has helped a lot of, I think, approximately more than 10 lakh people help got help from his relief camp. So relief camp, once it was was being set up, so like there have to be all the essential things which a human can need at the time of pandemic. So it has to be very relocated to the government centers, because from there they can transport essential services to the people. So like relief camps, they are totally having full of every essential services which was needed. So Naveen, if you can move to the next slide. Hello.
So Pawan, I'll come back to you with questions. Uh, we can go to Arina first when she speaks about Russia. Then you can speak later about the
Okay.
questions that we have for you and audience. तो अगर audience आपको कोई questions है तो आप chat box में डाल सकते हैं. So audience, if you have any questions, you can put in the chat box, and we'll try to answer you meanwhile. So thank you, Pawan, for your presentation. Now we'll move to Arina from Russia.
So thanks to my colleagues for the stories, and thank you, Naveen, for introducing me. And I want to repeat, my name is Arina, and today I want to tell you about the situation with coronavirus in Russia and in the neighboring country of Belarus. So as for Russia, you can see on the slide the official statistics of the Russian Ministry of Health. And as you can see, in Russia, we have about 200,500 infected people. The number of recovered is 48,000, and the number of deaths is about 2,000 people. And the graph below shows that the number of infected has decreased, which is a good sign. Also, the World Health Organization indicates that the statistics of infections in Russia have just reached a plateau, which means that the number of infections will not longer increase, but will remain at the same level for some time, and after which it will begin to decline. But I especially want to pay your attention to Moscow, because it is the most populated city in Europe, which means that the risk of spreading the virus is very high. And as you can see, half of all infected in Russia are in Moscow and in Moscow region. So during April and until now, residents of Moscow could leave their homes only with special passes, and it is a special card that allows you to go out. And this special card is given to people who have already done a coronavirus test and it turned out to be negative. With the help of such measures, it was possible to avoid mass infection in Moscow. So please go to another slide. Belarus is a country near Russia, and the situation with coronavirus is better here. The number of sick people is 25,000, 7,000 people have already recovered. But the president doesn't want to quarantine the country, and he says that since he doesn't see the virus in front of his eyes, it means that the virus is not there. And it is not a joke. I can give you the news where he says this, and this video has been shown around the world. In such conditions, the youth of Belarus decided to stop attending classes at the university in order to protect their loved ones, the family, friends, and teachers. And on the slide, you can see the headlines of the newspapers where it says that students don't go to university. Students themselves note that they didn't want to immediately protest and not attend classes, so the idea came up to collect signatures. But however, they didn't receive the support of the administration. Time passed and quarantine wasn't entered. Then students of one of the universities stopped going to classes. They were supported by students of other universities, and so the protest captured the whole country. And a week later, one young girl went to the office of the university administration. This was a 4-year student named Lisa. He explained their position on behalf of all students. So the administration said that classes will be transferred to the house only if they collect enough signatures. The guys created a single petition for the whole country, and everyone signed it. And a week later, the classes were cancelled at all universities in the country. And in my opinion, this is a very good example of the fact that young people have an opinion, and people are such citizens as the president and can protect their loved ones and can protect the country. So please go to the, thank you. So this is an example from my university. Students from my university organized a volunteer movement to help older people in quarantine so they don't have to leave their homes to buy food or medicine or something else. So the beginning of this movement is justified by the fact that older people are at risk of infection, and sometimes they're lonely, and unlike young people, they don't use numerous internet resources and other resources that could make life easier in self-isolation and just staying at home. So volunteers have two main areas of work. The first is help with the delivery of food and medicine home, and the second direction, so you can get a telephone consultation on the use of electronic resources, or ask how to use some service via internet. So volunteers use medical masks and wear gloves and always leave food or medicine bags at the front of the door apartment. And these volunteers, they call themselves superheroes, and they themselves say that their motivation is that in the modern world, which turned out to be completely unprepared for such changes, society needs philanthropy and mutual assistance. So that is why they make their small contribution to that society, so that society can cope with the disaster. So, and I, as you can see on the slide, I found several photos of superheroes on their social networks, but unfortunately they don't sign the names of volunteers and they simply post a photo report. So I can't sign the names of volunteers. So thank you for your attention.
Yeah, thank you, Arina, for your presentation and stories from your country. So, as you saw that countries, रशिया हो या फिर अफगानिस्तान या फिर इंडिया या फिर कोई भी कंट्री हो, तो वहाँ के सभी युवा अपनी अपनी तरफ से जो भी कोशिश हो सके वो कर रहे हैं. So young people from all across the globe are putting their efforts to fight COVID-19. Maybe from Russia, Afghanistan, India. I have so many countries in the world, and we don't have stories to share of all of them. But believe me, there are hundreds of young people who are doing their best from each and every country. So they should prove as a role model to you for this crisis. So now the main part like of our webinar was how to build your leadership skills what is the 5 main important things to build your leadership skills in this crisis. तो आप एक कैसे अच्छे लीडर बन सकते हो सिचुएशन को ओवरकम करने के लिए? तो पहला तो ये है कि बी ए रोल मॉडल, सो फॉलो द वर्ल्ड हेल्थ ऑर्गेनाइजेशन guidelines and your local government guidelines. So if you follow as a young person these guidelines first, then the people around you will get motivated. As a young person, you have to prove to be a role model in this crisis and follow the rules first. Seeing you, others will follow you. The second thing is educate others. दूसरों को इसके बारे में समझाइए अच्छे से. So आपके family हो, friends हो, community हो, whether it be your family, friends, community, verify news and share authentic information, fight fake news. So when you educate others, you should educate them with authentic news. There is so much of fake news. इतना फेक न्यूज है दुनिया में कि जो भी आपको मिलता है इंफॉर्मेशन सही नहीं मिलता, बट आपको सोर्स वेरीफाई करना चाहिए. You have to verify the source, get it from authentic websites. Even you can use our website to get authentic information and share the credible information, so that there is no misfortune in this case. Then third thing, volunteer. आप लोग volunteer कर सकते हैं, online हो गया, offline हो गया. All the governments of various countries including India uh, are open for volunteers like you, young people like you. So volunteer with local government. There are so many non-profits which are working in this crisis. So just identify those non-profits. आपके यहाँ जो NGOs है उसको identify कीजिए और just talk to them and see in what way you can contribute as a volunteer. Then fourth thing is fundraise. So help your local government and the non-profits around you raise funding. For example, in India, migrant laborers have been suffering so much, and so many volunteers have come up to raise funds, and they have fed thousands of people with food, shelter and clothing. तो ऐसे मुश्किल समय में इंडिया में काफी सारे वॉलंटियर एग्जाम्पल के तौर पे लिया जाए तो आए वो सामने, और उन्होंने गवर्नमेंट के साथ और लोकल एनजीओ के साथ वॉलंटियर किया है, और जो माइग्रेंट लेबर है स्पेशली उनके लिए खाना पानी कपड़ा हो गया, इन सभी चीजें उनको पहुंचाने के लिए मदद की है. तो फोर्थ थिंग इज fundraise. Help fundraise your local government and local non-profits. Then accountability. The biggest thing is hold your government accountable in this crisis. So as a young person, you should advocate for free testing, reliable information from government sources, paid leaves of your company or organization. Also, you should advocate for investment in universal health coverage and healthcare system. So as a responsible young person, responsible citizen of your country, एक अच्छे नागरिक होने के नाते आपका ये एम आपका ये रिस्पॉन्सिबिलिटी बनता है कि आप अपने गवर्नमेंट को अकाउंटेबल ठहराए. आप फ्री टेस्टिंग के लिए आप लड़े, आप रिलायबल इंफॉर्मेशन के लिए लड़े, पेड लीव्स के लिए लड़े, और अपने गवर्नमेंट को ये भी कहे कि वो लोग इन्वेस्ट करे हेल्थ कवरेज में और हेल्थ केयर सिस्टम में. सो एज ए यंग एज ए यंग पर्सन, दिस इज योर main responsibility that you do this. So through these 5 things, like first you should be a role model, second thing you should educate others in this crisis, third thing volunteer online or offline, fourth thing is fundraise either through local non-profits or for your government, and fourth one, the last one is hold your government accountable and advocate for free testing and other health services. So I think if you follow this 5 golden words or guidelines, then I think you can be a great leader in this crisis, and you can be a motivation to other, and also help your local community, your city, state and country to overcome this crisis in a short time. So going ahead, also we have a few questions to the panelists which will be followed by questions from you. So आपको अगर कोई क्वेश्चन है तो आप उसको चैट बॉक्स में डाल सकते हैं, जो हमारे पैनलिस्ट उसको आंसर करेंगे. So if you have any questions, you can put it in our chat box and we will answer them. But first we have some questions for the panelists. So first I would like to ask Mr. Pawan, are you there?
Hello.
Yeah, Pawan. So my question to you is like, युवा इस टाइम पे कैसे घर बैठे बैठे इस क्राइसिस को ओवरकम कर सकते हैं या फिर इस क्राइसिस को लड़ सकते हैं? इसको आप इंग्लिश और हिंदी में बताइए ताकि ज्यादा ऑडियंस को इसको समझ में आए.
थैंक यू नवीन. जैसा आप भी बात कर रहे थे कि किस तरह से यूथ इस तरह के क्राइसिस में घर बैठे अपने लोगों को, अपने देश को, अपने समाज को कैसे बेनिफिट कर सकते हैं, कैसे उन्हें बता सकते हैं कि वो किस तरह से कंट्रीब्यूशन कर सकते हैं। तो यूथ का जो भी योगदान है कि यूथ जो युवा है वो यूथ इज एज वन ऑफ द बिगेस्ट एंड पोटेंशियल सोशल कैपिटल ऑफ एनी नेशन। तो जो भी यूथ हैं इंडिया में ही नहीं, बहुत सारे अलग देशों में, जैसे अभी बहुत सारी कहानियां अभी हम लोग सुन रहे थे सभी के द्वारा, तो उसमें यही था कि यूथ आगे आकर अपने रिस्पॉन्सिबिलिटीज को लेते हुए बहुत सारे सेगमेंट्स में उन्होंने योगदान दिया है। तो यूथ का है कि पहले तो आप जो भी बता रहे थे कि जो भी उनके गवर्नमेंट्स की गाइडलाइंस है, जो भी WHO की गाइडलाइंस है, उनको फॉलो करें, घर में रहें। दूसरा इनका है कि क्या डिसमिनेशन ऑफ इंफॉर्मेशन, वो भी ऑथेंटिक इंफॉर्मेशन, करेक्ट इंफॉर्मेशन है, वो जितना ज्यादा लोगों तक वो अपने पहुंचा सकते हैं, अपने फैमिलीज के, अपने नेबर के, या फिर जो भी उनके मीडियम से उनके द्वारा जितने ज्यादा लोगों को पहुंचा सकते हैं इंफॉर्मेशन। क्योंकि अभी दुनिया दो तरह की लड़ाई लड़ रही है, एक तो कोविड-19 है, दूसरा है फेक न्यूज। जैसे आप भी कह रहे थे प्रेजेंटेशंस में कि जो फेक न्यूज का इतना बड़ा डेटा है या फिर इतना बड़ा रिस्पॉन्स है कि लोगों को कंफ्यूज है, कि कंफ्यूजन्स है, मिथ्स हैं कि कौन सही है कौन गलत है। तो हमारे जो भी यूथ है उनसे मैं ये अपील करूंगा, जो भी गवर्नमेंट्स के, इंटरनेशनल ऑर्गेनाइजेशंस के ऑथेंटिक रिपोर्ट्स हैं, जो भी उनके ऑथेंटिक गाइडलाइंस हैं, उनको ज्यादा से ज्यादा लोगों तक पहुंचाएं। दूसरा है कि जो वॉलेंट्री सर्विस है, जैसे कि पूरी दुनिया में जितने अभी वॉलेंटियर्स की जरूरत है, वो शायद ही कभी इतिहास में इस तरह की सिचुएशंस को हैंडल करने के लिए जरूरत पड़ी थी। तो यूथ है जो बहुत अलग अलग फॉर्म्स में गवर्नमेंट के साथ, दूसरे सिविल सोसाइटी ऑर्गेनाइजेशंस के साथ और अपने अपने पार्टनर्स के साथ, इवन खुद बहुत सारे ऐसे यूथ है जो वॉलेंटियर बन के बहुत सारे इनिशिएटिव्स लिए हैं, जिनके बहुत सारे हम लोग एग्जाम्पल्स भी दिए। तो वो भी एक मीडियम्स है कि उसमें वो अपने आप को कंट्रीब्यूट कर सकते हैं। तीसरा मैं ये कहूंगा कि जिस तरह से आप कह रहे थे कि यूथ की आवाज को भी सुननी चाहिए, यूथ को आवाज उठानी चाहिए कि गवर्नमेंट्स को, जो भी इंटरनेशनल ऑर्गेनाइजेशंस हैं, उनको हेल्थ सेक्टर पे ज्यादा फोकस करना चाहिए, या फिर वो इस बात को बताए स्टेक होल्डर्स तक, अपने काउंटर के साथ अपने गवर्नमेंट्स को, कि जो हेल्थ इंफ्रास्ट्रक्चर्स है वो कितना इंपॉर्टेंट है, कितना क्रूशियल है, कितनी जरूरत है देश के लिए। तो ये सब जो भी सेगमेंट्स हैं, हमने ये भी देखा है कि यूथ ही जो क्रांति ला सकते हैं, या जो भी कहते हैं हमारा जो मुहावरा है कि एक बदलाव ला सकते हैं, उनमें इनका बहुत बड़ा रोल है। दूसरा जो आप कह रहे थे कि क्राउड फंडिंग है, आजकल सोशल मीडियाज है, तो बहुत सारे यूथ के हम लोग ऐसे एग्जाम्पल्स में दिए जिन्होंने क्राउड फंडिंग करके या फिर बहुत सारे मीडियम से, चैनल से क्राउड फंडिंग करके या फिर बहुत सारे रिसोर्सेज को इकट्ठा करके, जो बहुत ज्यादा एक्सट्रीम नीड थे वैसे सेक्शंस को उन्होंने हेल्प किया है। चाहे वो बहुत सारे फॉर्म्स में हो सकते हैं, चाहे मेडिकल इक्विपमेंट्स का देना हो, मेडिसिन को उनको पहुंचाना हो, या फिर बहुत सारे ऐसे चीजें हैं जो उन्होंने खुद अपने कम्युनिटीज को रिसर्च करके देखा कि उन्हें क्या जरूरत है और सही चीजों को उनको डिलीवर किया। तो मैं ये नहीं कहूँगा, मैं ये कहूँगा कि यूथ खुद ही अपने आप में इतना ज्यादा इनोवेटिव्स है कि वो खुद ही बहुत सारे तरीके से निकाल कर अपने कम्युनिटीज को हेल्प कर रहा है। तो ऐसे
तो
बहुत
दूसरा,
सारे
पवन, आपका जवाब
ओके
काफी संक्षिप्त में था।
हाँ
तो दूसरा क्वेश्चन ये है कि व्हाट सजेशंस यू हैव यंग पीपल पोस्ट कोविड-19? जैसे कि ये तो ऐसे सालों भर नहीं रहेगा, 2-3 महीने में सब खुल जाएगा, लॉकडाउन खुल जाएगा, सब ठीक होगा। तो उसके बाद यंग पीपल क्या करे उसके बाद?
ये सबसे बड़ा जो सवाल है, आपने बहुत अच्छा सवाल पूछा कि जो हमारे कोविड-19 के सिचुएशंस हैं उनके बाद क्या करेंगे। तो जैसे कि जो यंग पीपल का रोल है, पहले तो यहाँ पास मैं कहूँगा कि फिटनेस या फिर जो भी हेल्थ है उनका, इस बात पे बहुत ज्यादा फोकस होना चाहिए कि जैसे मेंटल हेल्थ है उनका, वेलबींग है। तो जो भी ये सजेशंस है यूथ के लिए कि पहले आपको फिट रखे, अपने आप को मोटिवेट रखें, अपने आप को डिप्रेशन में ना लाए, बहुत सारे चीज है, बहुत सारे मीडियम्स है। दूसरा जो मैं ये कहूंगा सजेशंस की, लाइफ स्टाइल्स के चेंज होने की वजह से, क्योंकि नो वन वाज एडिक्टेड टू दिस काइंड ऑफ सिचुएशंस कि भाई लॉकडाउन में फंसे हुए हैं, घर में रहना है, बाहर नहीं आना है। तो एक सडन चेंज है लोगों के जीवन में, यंग पीपल के जीवन में और भी। तो मैं कहूंगा कि वो इसके लिए रेडी रहे, ताकि एक समय आने के बाद वो किस पॉपअप में कर सकते हैं। जैसे आप भी प्रेजेंटेशन में स्टार्टिंग में कह रहे थे कि जॉब्स का बहुत ज्यादा लॉस हो रहा है, बहुत सारे अलग सेगमेंट्स में है, इकोनॉमिक की अलग प्रॉब्लम्स है। तो जितने भी ऐसा मेंटल टेस्ट है, जो मेंटल हेल्थ है, तो उनको कैसे वेलबिंग कर सकते हैं। तो हमारा मेन प्रायोरिटी इस पे ये रहेगा यंग पीपल के लिए कि वो अपने आपको वेलबिंग पे ध्यान दें, सेल्फ का जो भी उनका डेवलपमेंट है, अपने आप को मोटिवेटेड रखे और फिट रखे।
Dhanyawad, Pawan. So we'll now move on to our next question. So this question is to Nuzhat. Nuzhat, are you there?
Yes, I'm here.
So Nuzhat, can you explain briefly what most
I
young
can hear
people?
you.
Yeah, can you explain briefly what most young people can do to help others in this moment of crisis?
Yes, actually, a big thing is to go along with the shutdown approach in all over the countries, not only in Afghanistan but in other countries as well, to drop down the rates of infection and let us go to the normal situation as soon as possible. As we can see, we have some heroic worker and some healthcare worker that they are working very remotely, and we have to support them, and we have to maintain the physical distance as they are requesting us to do so. And I think the biggest help will be the to follow the rules that issued by government and by healthcare centers, that some most of our people not caring about the rules, and they are going outside, and it will, I mean, spreading the COVID-19 among others as well. So I think staying home, maintaining the physical distance, and as well as staying calm even in this tough situation can help to fight with COVID-19.
Thank you, Nuzhat. So we have one more question for you. Like, how do you think the young business leaders can help
Yes.
people to reduce negative impact on economy? As we talk, like economy is drastically affected by this situation. So how do you think youth business leaders can reduce the impact?
Obviously, yeah. Thank you, Naveen, for your question. Obviously, it will be a big help from the young leaders, especially we have in Afghanistan as well some examples that we have shows that they are collecting money from the official government officials, and they are helping poor people. And as well as I know the economic of Afghanistan is not good, but still they are helping people from different using different approaches on that. And as well as we know that it had bad impact on the labor market as well. So physical markets are all over the country are closed, and they cannot open their shops to people, except some healthcare centers and some markets for urgent needs. But still, the people who are the social workers who are working outside the market, and they cannot even have the money to buy bread for their house. So I think this leaders, the young leaders who have money to invest on the online labor market, or we can say online services, the online services can help the people to come out, to come into work, and to have the I mean the uh, can you hear
Uh,
Naveen?
yeah. Just
Hello,
wrap up your answer. Yeah, we can hear you.
Naveen.
Yeah,
Naveen,
we can hear you. Just wrap up your answer, Nuzhat.
I cannot hear you.
Oh, I think there is.
Okay. Uh, so I think if our young leaders start the online services, and keep the those who haven't any job, it will help others to get the job, and to have their job back, and to help other people who are staying home and to use these services, and I think it would be a good option for, in my idea. I don't know about the others, but I think the online services, if come up, then we can.
Yeah, thank you, Nuzhat, for your uh, answers. So now we have a question for Arina from Russia. Arina, are you there?
Yes, I'm here.
Yeah, so Arina, my question is, what do you think may change in the world when this whole pandemic ends? What are the changes that have already taken place?
So I think that the changes will be incredible, and I know that many IT companies, for example, Google or Amazon, have already announced that until 2021, then they won't go to work in offices and may uh, transfer part of the work online. And for example, at my university, teachers who have never deal with with video calling and with computers, they now do it confidently. And I think that many processes, if they don't go online, will work much better online. And for example, my mother, she never paid bills via internet, and she simply didn't have such a habit, and now she has learned this and says that she won't go to the bank again. So I think that many processes will be more quickly performed via internet.
So thank you, Arina. My next question to you would be like, how will the coronavirus affect governance approaches, and what kind of leaders do we lead now, especially in context to young people?
Mhm. Uh, in such conditions, leaders of all levels need crisis management skills, and people working for the state should develop such skills because our future after the coronavirus is a global crisis. So, however, a leader, in my opinion, a leader is not only a person who knows how to quickly and competently manage people. He's also an example to everyone around. So, and for a leader, all the trouble is experience, and he can inspire people and engage in his work, and such people are truly inspiring. I think about what to do in a completely unfamiliar situation for which there are no ready-made solutions, and therefore there is no successful experience. In this case, the person's ability helps to study, analyze, and a new situation for him and act in accordance with the conditions. So thanks to these actions, new knowledge and new experience appear. So I think we just need leaders who can make decisions in unusual situations.
Yeah. So my one more question to you would be like, what like any general guidance apart from all this that we have talked? Do you want to share anything else from what you have talked, Marina?
Can you repeat, please?
Like apart from all that we have talked, do you suggest some other things for young people to overcome this crisis?
No, I think that I don't have any suggestions and like real examples. I have only like I can imagine how it has to work, but I don't know what to do. You know, like
Yeah. Okay. Thank
yeah.
you. So we'll be moving to the questions from participants. So two or three of them had put their questions. One is related to vaccine. So one of the participant asked, "What about the vaccine status in India, especially?" So to tell the overall thing, so vaccine development is estimated that it might come by next year, mid or maybe fall of 2021. So right now, hundreds of organizations across the globe are working to develop the vaccine. Coming to India, the PM recently the PM fund has released 100 crore for vaccine development. So the Department of Biotechnology in India have selected 10 proposals for the vaccine. So they are going to fund them, mentor them for the vaccine. Also, recently, China has tested a vaccine through a rhesus monkey, which they claim might be the potential cure. So more of human trials are coming up. Coming to United States, they have partnered with some organization in European Union where the human trials are right now going on. And one of the biggest lead that right now is with Israel also. So even the Israel country has come up with potential vaccine. So they are running the phase 2 and 3 of this vaccine. Also, Oxford University is way ahead in the research of vaccine. So they are also running clinical trials phase 2 and 3. So in the coming months, by September, the results of these trials will be out. Then probably, if everything goes fine, so by latest by this year end, we might have a vaccine. Seeing the current efforts that are being put by different organizations, or it is estimated that at least by mid 2021 or fall 2021 we might have a vaccine. So previously, for a vaccine development, the quickest was like 12 to 18 months. So I think since the advancement of science and technology, we might come up with a vaccine. But also, people have asked about the mental health, so how to deal with mental health. So coming to the webinar one, so in webinar one we have completely discussed fully with our panelist who was a doctor and a psychologist who clearly explained. So you can go to our webinar one, which is on our YouTube page, and see the whole series. But just to give a quick idea, so how to overcome this mental health issue is, of course you should maintain distancing, but people tell you maintain social distancing. But we discussed आपको social distancing नहीं maintain करना, आपको physical distancing maintain करना है. So maintain physical distancing and not social distancing. So talk to your friends, family, like don't be alone all the time. Just talk to them. Maintain physical distancing, but not social distancing. So in this way, you'll be more free-minded. So then, when you talk to your family and relatives, then also try to eat healthy and sleep on time, long, at least 8 hours a day, which keeps your mind calm in this crisis. So if you have less sleep and bad food on this crisis, it will the effect will be multiplied. The bad effects will be multiplied. So eat good food and try to sleep at least 8 hours a day. Drink 5 liters of water, and also keep on talking to your friends and relatives over phone or video call or whatever you can do. Then another thing is, like, do not see too much of news which is about coronavirus. Like, try to limit your of course you need latest information about coronavirus, what is happening, what's the situation, but try to limit news related to coronavirus, and watch some old sports videos, watch some football or cricket, or just whatever. If you can play some indoor games at your home with your siblings or with your family members, maybe shuttlecock or something in your compound, within the compound. So just try to play some games with your family, just within your compound, within your home. And also, there are many online courses available. Try to do some online courses, online stuff. And if you come to our website, we have whole resources which have been released from WHO, Harvard Global Institute, and other institute. So you can just log into our website and click mental health option there. And if you click there, so you'll have variety of resources available. We have also resources for young people, for online education, etc. So these two questions about vaccine and mental health were the main one. And now we want to thank the panelists Arina, Nuzhat, and Pawan for their valuable time and guidance. And we also specially thank you for taking out your time and being a part of this webinar. You can watch the recording of this webinar on YouTube. Then also, if you log into our website, coronaviruseradication.org, you will get the latest data and statistics about this crisis. And also, you can join our Global Youth Task Force. You can volunteer online, offline. You can also subscribe to get daily notification and the latest news about COVID-19. So that's all from our end. So we'll be coming up with more webinars in the coming time. So I once again thank the panelists and all the participants of this webinar, and I wish you good health. So maintain physical distancing and not social distancing, and also try to be a young leader who brings social change by the examples you have saw in our today's webinar. And also there are hundreds of examples from all across the globe. And yeah, so thank you everyone, and we wish you all the best. Thank you.
Thank you, Naveen, and thanks to all our participants that joined us in this webinar. Thank you all.
Mm.
Thank
Thank
you.
you. Thank you.
Yeah, bye everyone, take care.